This episode is brought to you by my Fertility Awareness Mastery online self-study program. Learn fertility awareness from the comfort of your own home at your own pace for a fraction of the cost. Head over to fertilityfriday.com/mastery for details. That's fertilityfriday.com/mastery. This episode is brought to you by my very first book, The Fifth Vital Sign: Master Your Cycles and Optimize Your Fertility. With over 1,000 research citations, it is the most comprehensive resource on fertility awareness and the menstrual cycle to date. The Fifth Vital Sign is available in paperback, ebook, and audiobook formats on Amazon.com. Listen to The Fifth Vital Sign for free when you sign up for a 30-day trial with Audible. Visit fertilityfriday.com/audible for details. That's fertilityfriday.com/audible. This is the Fertility Friday podcast, episode number 266. Welcome to the 266th episode of the Fertility Friday podcast. Thank you for joining me today. I'm Lisa from fertilityfriday.com, and this is your source for information about the fertility awareness method and all things fertility. Okay, I know I say it every time, but I really am excited to share today's episode with you. In today's episode, I welcome back one of my past guests, Dr. Erika Enos, to the show. And in today's episode, we are talking about detoxification. And I particularly love this conversation because I really appreciate every opportunity I get to debunk some of the myths, the most common myths, I guess I could say, about detoxification. And so when we think about detoxification, we often think about doing a protocol or program and eating a certain way and, taking supplements and doing all kinds of stuff to force detoxification to happen. But what I really appreciate about today's episode is that Dr. Enos takes us through a detoxification process that really begins with looking at what we're exposing ourselves to, what are environmental exposures, whether it be at home or, in our environment. But what I really appreciate is that she really takes us through and sheds some light on what it really means to support the body's detoxification pathways. Because ultimately our bodies are detoxifying all the time. And so a big part of detoxifying is just stopping, a lot of the exposures that we have on a day-to-day basis. So becoming aware of where we're being exposed to, varying chemicals and xenoestrogens and all kinds of compounds that can disrupt our normal endocrine function. So, step one, become aware. Step two, start reducing our exposure to those things. And then I won't give it all away, but there's a lot more that you can do once you at least get that process started. But what I appreciate about this conversation is that Dr. Enos highlights things that each of us can do. Anybody who's listening to this episode right now, there are specific actionable takeaways that you can really implement in your own lives today. So there's a lot of things that you can do today to start this process of detoxifying the body and really just moving towards healthier endocrine function, hormone function, liver function, and all the things that come with detoxification. And whether you are actively trying to conceive, actively avoiding pregnancy, but, in either case, looking to understand what's happening in your menstrual cycle, if you've started charting your menstrual cycles and you're looking to learn more about what factors can impact your cycles for better or for worse, and particularly if you're looking to improve your menstrual cycle parameters, as you go through this detoxification process, you may notice some significant improvements on your charts as you work towards just achieving optimal health and achieving optimal hormone balance. If you're ready to delve further into the wonderful world of fertility awareness, I have curated several excellent resources for you. If you haven't yet purchased your copy of The Fifth Vital Sign, it is available on Amazon in paperback, ebook, and of course, audio formats. And you can download the audiobook for free with your free trial of Audible. So you just head over to fertilityfriday.com/audible. And today's episode is also brought to you by my Fertility Awareness Mastery online self-study program. This program is the most comprehensive fertility awareness self-study program available. And the best part is that you can learn at your own pace in your own living room for a fraction of the cost of joining one of my live coaching programs. So make sure to head over to fertilityfriday.com/mastery for additional details. That's fertilityfriday.com/mastery. Now, without further ado, let's jump into today's episode with Dr. Enos. And today I'm excited to welcome my guest, Dr. Erika Enos, back to the show. Dr. Enos is a registered naturopathic doctor in the state of Colorado and owner of Healing Roots Natural Medicine. Dr. Enos strives to understand and help her patients to understand and correct health issues by identifying their root causes. While Dr. Enos works with patients with a wide variety of issues, her area of expertise is autoimmunity and medical mysteries. Her approach to care involves a unique blend of the best of traditional naturopathic medicine, biotherapeutic drainage, and functional medicine. Dr. Enos completed her naturopathic degree at National University of Natural Medicine and her undergraduate degree at the University of California at Berkeley. And so for those of you who remember, I'll link the previous episode that Dr. Enos and I recorded together. We talked about thyroid health, and I know that episode was quite popular, and we talked about, it was a really comprehensive episode, so you'll definitely want to tune back into it. But today we're going to be talking about detoxification, and I'm really looking forward to getting into that and kind of busting some of the most common myths about what we need to do in order to support our bodies to detoxify. So without further ado, welcome to the show, Dr. Enos.
Hi, thank you, Lisa. I'm so happy to be here and talking about detox with you this morning.
Well, thank you for coming back to the show. I'm excited to have you, and I'm really excited, as I was mentioning in our pre-chat, I'm really excited about our topic today, detoxification. It's something that I've, over the years, it's come up on the show quite a bit, just the idea of, what do we need to do to detoxify, but we've never really taken a deep dive as we're going to do today. So really looking forward to that. So before we jump into all of that, maybe share with us a little bit about your background. As I was reading the bio, of course, when I said, medical mysteries, that intrigued me. And I'm sure some of the listeners are like, what kind of medical mysteries? So maybe just share with us a little bit about your practice and shed some light on what you do and what brought you to what you do as well.
Yeah. So I'm a naturopathic doctor, as we covered already. And so that means that I look at a really holistic picture of what's happening with people and not just focusing on what we call a biomedical diagnosis, which would be like hypothyroid or hypertension or lupus or something like that, but looking at the different components of how well the body is working and working to restore health as much as focusing on a disease diagnosis. And so that's sort of where this idea of medical mysteries come in. I definitely get a lot of patients who maybe have been to see many different types of doctors and specialists, and they don't have a diagnosis, but they've got a lot of symptoms. And sometimes I can make a diagnosis that hasn't been made, but other times we focus more on looking at what underlying physiology in the body needs support and needs correcting. And that can help bring them back to health, whether we can make that biomedical diagnosis or not. And that's a really beautiful thing about naturopathic medicine and functional medicine, is that we have lots of ways of restoring health, regardless of what's going on for people.
Mm-hmm. Well, it just made me think. I recently recorded a podcast interview. So at the time we're recording this, it hasn't been released yet, but I recently recorded an interview with Dr. Aviva Ram. And what was interesting about that interview is that she was talking not in the same language, but similar thing, where patients were coming to her, female patients in particular, with certain symptoms that she hadn't really learned how to address in a functional way in medical school. And so that prompted her, obviously, to look at things a lot differently. And so it made me think about medical mysteries. I'm not sure if you've experienced that with more female or male clients or if it's across the board, but I was just curious what your experience has been.
Yeah, definitely more with female patients, but naturopaths and probably medicine in general, we tend to see a lot more female patients, and we have really complex physiology and anatomy that I think lends itself to those mysteries more. And I think it's worth acknowledging too that because of the way medicine has evolved in a somewhat patriarchal fashion, it's very oriented. Yeah, somewhat. It's more oriented actually towards treating men and taking their symptoms more seriously. So we definitely get more of that with women.
Mm-hmm. Well, thank you for shedding some light on that. And honestly, that kind of concept of women's symptoms and being like misunderstood or feeling like it's a mystery, I feel like that spills over into anyone who works with women in any capacity, because part of the work that I do, I'm demystifying the menstrual cycle. I'm filling this gap of, what the heck is going on? Why wasn't I taught this? And I would imagine that you have a lot of that unpacking to do in your practice as well.
Yes, absolutely. There is tons of unpacking to do. And I think there's always the continued asking of why something is happening. Even if you find a result on a test that seems like it's the cause of something, you always have to ask, why are you getting that result? Why this? Why that? And just peeling back layers for people. That happens, being somebody who treats a lot of autoimmune diseases, and those are very complex. There's not just one thing that triggers them, and it's very unique to the individual. That unpacking process is really important.
Mm-hmm. Well, and of course, what I love about naturopathic medicine and functional medicine is that we're looking at the whole person. And so that ties into our topic of detoxification today, because I think we're starting to recognize the role of toxins in health issues and illness. Mm-hmm. But I feel, I was actually talking to a friend this morning, and I mentioned that a couple of years ago I went to a conference and I had the opportunity to interview Dr. Joseph Pizzorno.
Great.
His research extensively is in the area of toxins and how they relate to various health conditions. And his talks completely blew my mind, because it's very different to what we hear. We don't necessarily realize how significant a role that toxin exposure and just toxicity in general could be playing in unrelated, seemingly unrelated health issues. So it's on our radar, and a lot of us have that sense of, okay, we should be doing something, especially women who are in that process of, thinking about trying to conceive. So we're all thinking, okay, we need to detoxify. And often the first thing we think we need to do is go out, to the supplement store and buy like a liver detox or do a flush or a cleanse. So share with us how you approach detoxification in your practice, and how, it's not just about doing a flush or a cleanse or taking herbs. Teach us.
Yes.
Teach us, Dr. Enos.
Fantastic. Yes. So I break detoxification up into several different categories. And the first thing that I really encourage people to think about is first stopping and decreasing exposure. So that's going to be removing as many toxins as possible from the environment, and then paying a lot of attention to what you're eating and what you're drinking. So your food and your liquid there, because those are the things that you're exposed to every day, day in and day out. And they're going to have a much greater impact than a kit that you buy at the supplement store. So starting with removing and decreasing those exposures, and then starting to cultivate habits that you do on a daily basis, on a weekly basis, to support your body's own routes of elimination is very, very important, because we are inundated with toxins every second of the day that our ancestors were not inundated with. And so your body has all these wonderful capacities to detox, but we overload it. And so making sure that you're doing things on a daily basis that's going to support your body in detoxing all the time. And some of that is just making sure that you are doing very simple things to support your body's natural routes of elimination. And then there can also be increasing certain foods, and maybe some functional foods like herbs and different types of teas that can help your body on a regular basis, supporting those detoxification routes. And then perhaps addressing specific detox needs based on your specific goals, symptoms, diagnoses, things like that. And then I really encourage people to think about something that they might do yearly or seasonally to help sort of reset, maybe a little bit more targeted detox, whether that's using an elimination diet and increasing saunaing or things of that nature. But those are generally the things that I think of in terms of detox.
Well, I'm glad that you broke it down that way for us. I feel like we can spend some time maybe going through each of those so that we have a better idea. And I feel like it's empowering for a couple different reasons. I mean, it gives us some very practical ways to do it, and also illuminates that it's not just one thing that we can do. It's kind of like a process, and there's layers to it. So there's things that you can do kind of on your own, but depending on what's happening with your health, there may be deeper layers that you're wanting to work with a practitioner to actually go into and address more specific to you. So, I mean, the conversation about reducing chemical exposure, that's something that I'm always talking about on the podcast. Mm-hmm. And so from your perspective, from your seat, I know for me, one of the first things that comes to mind are, especially for women, are all the products that we use, because ultimately every product marketed to a woman for cosmetics and beauty contains a ton of chemicals. Unless you're going out of your way to look for products that don't contain chemicals, everything in your cabinet is full of them. But that's only one source. There's the stuff in the food, and then how far do we take this? There's the stuff in the carpets.
That's off-gassing, right? You walk outside, there's air. You cook with nonstick pans, it's there. Like, it's just, share with us a little bit about some of the practical ways we can reduce our exposure, but also how you have these conversations with clients, because the moment that you get into it, it can feel so overwhelming. It almost is like you just want to put your head in the sand because there's so many different avenues that we're, being exposed to different toxins and chemicals.
So when I have people do their new patient intakes, one of the things that I have them do is actually check off things that they're exposed to and areas that they're exposed to. So, do you use air fresheners? Do you use perfume? Do you use antiperspirants, nonstick cookware, this kind of things? But can get an idea of where they're starting from and what they're exposed to on a daily basis. And then we often have a conversation about what would be easiest for you to change first and what might be most specific to your condition. So for instance, if it's somebody dealing with thyroid issues, one of the first things I might have them do is filter out the fluoride and the chlorine from their water, from both their drinking water and their shower filters too. And then I suggest that people start with, as they finish up a product, they replace it with something of a cleaner quality. And often I tell people to run it through the filter of, one, when I read the ingredients, could I eat those? Do I recognize them as somebody who's not a chemist? Could I eat them? That's a great thing. And if you can eat it, it's probably safe to put on your skin or to clean with. And then I often have people also access the databases of the Environmental Working Group, which is a nonprofit sort of watchdog group that puts out all these great lists identifying different products and how safe they are for us. And it's an absolutely great list because a lot of things are mislabeled as natural, or maybe not mislabeled, that might be true. It might be primarily natural and they can absolutely label it that way, but it doesn't mean it's totally chemical free. So having a database that actually rates these things on a scale is a absolutely great tool to have for people. So I ask people to really do that with their personal care products and their cleaning products. And cleaning products are really good, actually, I think a great place to start because they're very inexpensive to replace versus personal care products, where the more natural ones can often be more pricey. And with cleaning products, you don't need to buy a fancy natural cleaning product. You can absolutely do a ton with distilled white vinegar that you can buy in large drugs for a few bucks, maybe add some essential oils for good smells, and that can go a long way as a multi-purpose cleaner in the house. So that is a really great place to start. And then I also encourage people to think about their laundry detergent, since they'll be washing the clothes that they wear every day in that laundry detergent, and they're going to be sleeping all night in sheets in these laundry detergents that can be really chemical based. So thinking about that, and in that note, thinking about maybe taking out dryer sheets and swapping them for some cotton dryer balls. So very simple things that you can do before maybe jumping into that personal care product, because that can definitely take some trial and error, figuring out what is going to work for your skin and your hair and things like that. But women do, as you said, we're exposed to so many chemicals in our products. We're exposed to about 160 plus of them every day, which is staggering. I think of myself as somewhat of a minimalist, but I'm sure I'm exposed to at least half of that, But there are some really good options out there for personal care products too that can be really, even if it's simple as, swapping your lotion for just a plain shea butter, things like that. Mm-hmm. So those are some places that I have people start with their personal care products, their cleaning products, things like that. But then you can also really jump into other things in your environment of like the air in your home can be a really important thing to address. So I encourage people to get away from scented air fresheners and use a vacuum cleaner that has a HEPA filter. Those can be good places to start. So the issue with the scented air fresheners is that they often contain phthalates for that scent. So pretty much any time you have a product that has a scent in it that is not an essential oil, if it says fragrance, perfume, something like that, it's going to contain these phthalates, and phthalates can have a very big impact on the endocrine system. So I always tell people to watch out for those scents, essentially.
Mm-hmm. I feel like you've given us a lot of very practical and helpful advice. I know whenever I'm having these types of conversations with clients, when you're charting your menstrual cycle, sometimes you can kind of see the benefits or experience the benefits of this. I know a lot of women may, gradually decrease their exposure to toxins and these types of products and notice an improvement in their cycles, a decrease in their pain. It's, there's no guarantees, but for a lot of women, this changing just that can make such a big difference. And the challenge is that a lot of us, especially the type A among us, we want to do it perfectly. And there might be the notion that we could at some point be totally pure or something. So I like to kind of, there's a lot of benefit in reducing your exposure, because at the end of the day, you always have to go outside and breathe air at some point, and the air is polluted. And so there's no such thing as being totally pure and clean in the world that we're living in. But with that said, I feel like it can kind of set you up for success in that you can make a huge difference just by reducing, instead of making the goal to be like perfect or pure.
Yes, right. Absolutely. And my house is not perfect and pure either. We make the changes as we can and as we become aware of them, because there are things that we're not aware of that can cause toxin exposures, and just kind of swapping those things out over time and as we can afford them. And you're absolutely right. I have a number of patients who they're already on board with doing things naturally. So they come in and they already have the toxin-free cleaners. They're using all natural skin products and things like this. But again, as you said, we still go out into the world. And I think about this a lot when I go into stores and I get hit with smells all of a sudden, of the clothing, the perfume counter, the smell of the clothing, the smell of the rubber on shoes, this and that you can. And really, when that's not in your home environment, you smell it a lot more when you go out in public. And so you can't totally escape these, no matter how clean you keep your personal space. And so definitely you want to work on reducing and doing what you can, and then supporting your detoxification routes as much as you can. So that's another place that you can make some changes and really have a lot of control over.
Well, and before we move into the next point, I just wanted to get a sense from you because, there's the concept of just overall general health and detoxification and reducing our exposure. But I think it's quite clear that some people are more sensitive than others. People react differently to these types of toxins. So whereas, perhaps you or I, if we were hanging out at the mall or something, I walked into one of those, I won't name the store, but just picture the stores that have all the things with all the smells, all the hand lotions and whatever. And, you and I might not like it. And I've noticed the same thing that you alluded to, where getting rid of all that stuff in my house, I am so sensitive now when I go outside. It's like I can smell cologne like a mile away, but it doesn't cause me to break out into a rash. It doesn't cause me to have any type of reaction. I just don't like it, and I'm very aware of it. Whereas you and I both know that there are some people for whom that type of exposure is actually going to make them very sick. So maybe you could speak a little bit to the bio-individuality of this and why, I know it's a bigger topic, but just allude to maybe why some people are much more sensitive to others.
Sure. So I think that really comes down to a couple of things. And one of them is our genetics. We all have different genetics of how we detoxify. And some of us are quite a bit more sensitive than others. And that's really not pointing to a weakness. I think sometimes people are given a really hard time if they get a headache from perfumes or things like that. But really, it's just that their alarm bells are that much more heightened, because it's really going to impact all of us in terms of this sort of continuous exposure and the type of chronic diseases it can set us up for. So in a way, those people are somewhat lucky because they have an alarm that this is not a good thing for their body, that it's a toxin, which they are. So there is that genetic component of it. And then you can also think of it as like how full is your toxic burden that's going to make you more reactive to it. So I often use the analogy with people of having your body as a bucket, right? And I tell them, for this body bucket to work well, it has to be clean and it has to be empty. And we have these natural routes of detoxification that are emptying this bucket on a daily basis. But these really evolved in a world that was much less toxic than the one we have today. So our organs and our systems of detoxification evolved where they were detoxing things like the adrenaline from the hunt, smoke from the smoke fire, the natural toxins we get in foods. And so they're good detoxifiers, but the burden that we have today is really a lot for them. So for many of us over time, this bucket gets dirtier and dirtier, and it gets fuller and fuller, and at some point it spills over. And so some people will already have such a high load in that bucket that these exposures are just what's tipping them over and having things come out on their skin, and headaches and things like this. And so I think of that really as an indication that we need to work on those inner routes of detoxification, work on how their liver is working, on how their kidney is functioning, how well their gastrointestinal tract is working, and these different main routes of elimination. And that can help them be less reactive to toxic exposures too. I think it is important that we can identify and smell toxins, as you were saying that you do when you go into a store, but we don't want to have this overreaction to them either.
I really like the way that you explain that. It just makes so much sense in just taking into account all the different factors, from your own individuality to the fact that a lot of us are really overloaded, and that could be a symptom. And so I really appreciate you taking us through that. The reducing exposure to chemicals, I'm glad that we talked about that, and now the listeners have some practical ways to do that. And it can't be understated how important that is, because that's your daily exposure. If you use mango smelling lotion, not to diss mangoes. I love mangoes, the actual fruit. But if you're always exposing yourself every single day, I mean, that's a habit. And that's going to, imagine over 10 years how removing the mango lotion is going to impact your overall health if you're not exposing yourself to that every single day. So one of the other steps that you mentioned was cultivating regular practices and regular habits that support our detoxification pathways. So share with us how we can do some of those things in day-to-day life.
Yes, absolutely. So some of them are just simple things that most of us are doing at least some of already, but the goal is to make sure that you're doing them regularly. So starting super simple, just making sure that you're drinking adequate water. I just can't believe how many times people will come back and be like, wow, that water made so much difference, right? And it's so simple. We all know we should be drinking it. And probably a lot of your listeners are already staying hydrated just because of your population. But you don't want to underestimate that. And so I often go by that rule of thumb of half your body weight in ounces of water. So if you weigh 120 pounds, that would be 60 ounces. And really getting filtered water and putting it in a metal or a glass container, and really avoiding that plastic. Even if it is BPA free, there still are going to be other phenols and other issues in that. So getting that filtered water is really important. In daily, your body is a good 80% water, and every single cell in your body is bathed in a water-based substance. So it's very, very important that you stay really well hydrated. And then thinking about simple things like moving your body on a regular basis. And this might be, and I say movement because when you say exercise, people often think of going to the gym, doing CrossFit, things like this, but really even just movement and increasing movement throughout the day, because movement and moving your muscles is what helps lymph flow and move in your body. And lymph is a substance that moves toxins out in your body. So it's really important. Even if you're going to the gym regularly, you want to be moving throughout your day. So not sitting in front of a computer for 8 hours and then going to the gym doesn't quite cut it in terms of detoxifying. That being said, having those times when you're exercising to the point of sweating is also really important, because your skin, you can think of your skin as a detoxifier in a number of different ways. And the main way it's supposed to work as a detoxifier is through sweating. But when you see things like mystery rashes and adult acne and eczema and things like that, that's really a sign that your body is using your skin as a sort of inappropriate route of elimination, right? Or not primary. But that sweating is super important. So making sure that you're doing that. Also, getting really good sleep is important to detoxification, because sleep actually helps boost glutathione levels in your body. And glutathione is one of your body's major detoxifiers. So making sure that you're getting a good at least 7.5 hours, but many of us need 8 or 8.5 hours to get those good levels of glutathione. You can also think about doing dry skin brushing is another lymph mover that I love to have people do. So this is just taking a natural fiber skin brush and brushing it gently across your skin up towards your heart. And I encourage people to do it daily and just do it for a couple minutes. So a lot of times you'll see instructions where it says dry skin brush for 10 or 15 minutes, but most of us won't do that more than once every few months if we have to do it for 15 minutes. So think about how you can make it as a regular basis, regular thing that you do. And then I also encourage people to do deep breathing every single day, because our lungs are a major detoxifier, and they're going to bring oxygen to your tissues for repair and cleansing. And then it also helps support our emotional balance. And if we're out of balance in our nervous system, it is very hard for a cell to detoxify. And I also tell people to think of your emotional body as a route of elimination too. We can have emotional toxins, absolutely. So balancing that is really important. So those are some of the very basic habits that I have people do on a regular basis. And again, they're super simple, but if you really check in with yourself, are you doing most of those every day? And a lot of us aren't.
Well, it's so interesting that you mentioned that, because I feel like whenever this is why we're having this conversation, and this is why I was really excited to delve into detoxification with you, because when people talk about detoxification, it doesn't really like drinking water and making sure you're having a good night's sleep and focusing on deep breathing. These are not the things that come to mind when people talk about detoxification. And I mean, there's so much research to show why especially sleep. I mean, it's the research about sleep is just crazy in terms of how many health conditions are related, or the chances of you experiencing them increase significantly when you don't get enough sleep. Like it's really staggering. But even though it's like this free thing that's available to all of us, it's often, I know for myself, I struggle with it. I'm not the best. I have I'm a stay up late-aholic or something. Struggled with it from the time I was a little girl. And, I have a lot of empathy for the challenge of literally just making sure you're getting into bed on time and getting a good night's sleep. Maybe you could share with us just what you've seen in your practice for clients who, take the reins and actually implement and cultivate these daily habits. What are some of the results that you've seen just by doing some of these basic things?
Sure, absolutely. So it's not uncommon for me with a new patient to simply put them on like an elimination type, detox type diet and recommend some of these daily habits. And so I will perhaps recommend all of those, drinking water, getting enough sleep, deep breathing, dry skin brushing, and then castor oil packs are another common thing that I'll use with people. And sometimes I will prescribe just that on the first visit and then perhaps see them a few weeks later. So one story that I love to tell that I think was very much a combination of taking toxins out of the diet. And in this case, it was using an anti-inflammatory paleo diet. So you're getting out. What I love about this diet is it takes out any chance of processed foods, really more than any other therapeutic diet. And so you're getting out a lot of toxins in the food and just doing those basic, what I call foundational habits with people. I had a woman come in, and this was a few years ago now, at least, with a autoimmune condition called scleroderma. And so in this condition, it really affects the collagen in the skin, and the skin gets, which we think, okay, collagen, we love collagen and it makes our skin look plump. But in scleroderma, it gets really overproduced and it can cause the hands to really contract and kind of close up so that you can't use them to like open doors or things like that, and can cause a lot of like tightening in the face. The skin gets very, very shiny with it. And she came in and we did these basic things with her, and I saw her about 2.5 weeks later, and she had just such remarkable changes from these basic detoxification measures. She had a lot more flexibilities in her hand, and she was able to drive to the appointment, which she couldn't 2.5 weeks earlier because of the flexibility in her hands. So pretty incredible. And people had commented on how much her skin had changed, things like that.
And you hadn't prescribed her any medication or any supplements or anything. It was just like, let's incorporate these habits, change up the anti-inflammatory diet, as you mentioned, and get thee to bed, etc.
Yeah, exactly. So there's another case that I can think of where I did a less extreme diet. We just had her, she was eating like bagels with cream cheese for breakfast. And so lots of like refined carbohydrates and whatnot. And she came in with pretty bad cystic acne. And again, let's increase your greens. Let's take out the flour products. Let's do these basic detoxification measures, and acne reduced by about 50% 4 weeks later. So really big change from those basic things for people. So it can be super dramatic.
Well, and you've alluded to the skin conditions and what you said about the skin. We can think of it as a detoxification organ, but also in cases where there's other things happening, the skin can be this route of, I think you called it like inappropriate elimination. But
yes.
If you think about, because when I was growing up, I thought of acne as an issue with your skin. And I remember when I, at some point learning the connection between your, overall health, gut health, et cetera, detoxification issues, and that relationship to the skin. So again, with your perspective as a naturopath, as a functional medicine doctor, essentially, you're looking at that as a symptom of something that's happening and trying to address that symptom. And it's so interesting because what do we do? What does Western medicine do when we have acne? We think of it as a skin condition. We don't look at the body or look at all of those things. And then we give someone lotion as if they have a lotion deficiency.
Exactly. Yeah. So I usually tell people the only true skin condition is contact dermatitis. So that's like poison oak, right? That's the only probably true skin condition, is where it's like a topical thing that has caused it, and everything else has an internal cause. And it is sort of the perfect model for looking at detoxification in the body, because it's really usually a combination of a person's liver and gut and how those impact our hormones. And then often their kidneys too can really have an impact on how their skin is doing, how healthy it is.
I guarantee you that there are listeners who are doing whatever they're doing right now. They're like on their bicycle or whatever, or like walking their dog, and their minds have just been blown. So thank you for that. Thank you.
It's always good to blow people's minds with some.
Excellent. Yeah. So we've gone through kind of then the environmental, we've gone through the daily habit. Again, very, very helpful, very practical. And if everybody on earth just did those two things, just imagine the wave of health improvements, even just the subtle, as you mentioned, your client whose acne improved by 50%. That's huge without any medication.
Yes.
So then what happens? I mean, it's going to be different for every woman or man or whoever's in the situation. But what happens when it's something more serious? What happens when you have a patient that's presenting with certain symptoms that prompts you to then do like a full panel, or they're looking for toxicity. Maybe they have symptoms that would indicate that might be an issue for them. And you find out that there is something wrong. So obviously this is a whole other realm, but for the person who's listening, and I mean, there's a lot of buzzwords, especially for women who are charting their cycles or trying to conceive or trying to figure out what's wrong with their cycles. Buzzwords like, okay, well, I know if I'm on birth control, I might, it might throw off my copper zinc balance. I might end up copper toxic, or maybe I've been exposed to mercury. Maybe I had mercury fillings my whole life or whatever. Sure. But there's a lot of kind of buzzwords. So what are some just general things and just advice for a person who is concerned about a more specific to them issue regarding toxicity?
Yeah. So in those cases, I do think it's a good idea to work with a practitioner who can really shepherd you through the process of decreasing toxins and really figuring out which internal organs need support. We often think of the liver, and that's a really big one that we can talk about, lots of different things that people could do easily and safely on their own to support their liver, but sometimes deeper work needs to be done, and it might need to be done in different organ systems to support their detox. And so as a naturopathic doctor, part of what I'm assessing and part of the diagnosis that I'm making is which organ systems need support, which ones do we need to help detox, and which ones do we need to repair for people with that. And so sometimes I'm making that assessment for people just based on pattern analysis and symptoms. And other times I will run testing, like heavy metal testing, or looking for environmental pollutants as well. So there are different types of testing that can be done in urine or blood to look for those toxicities for people. You can look at how well a person is methylating too from their blood work, and that can give you some ideas of how they're detoxing with that. But there are so many different ways that it can be approached if you've determined determine that somebody needs particular detox support. And some of that might be, again, like using certain functional foods to support their detoxification, or supplements like B vitamins or glutathione or antioxidants. It might be using different herbs, like dandelion's a common one that probably a lot of people hear about, or milk thistle or rosemary or juniper or things like that. But for most people, I think that detoxifying process is really kind of a layered approach, and it's not a one size fits all where this is the detox program that everybody should do, because everybody's body is so unique. So what I typically will do is, after, let's say that we've done that initial treatment plan with making some dietary changes and some of those foundational habits, and we see what symptoms are left and what their body still needs, and then address the main organ system or system that needs support at that point, and then see how they respond to that and decide what comes next in terms of detoxification. So those are some of the ways that I'll approach that. And, as you mentioned, heavy metals are a big thing. And I would actually encourage women to get those tested before getting pregnant, because it can be a big toxicity that can not only impact fertility, but it can also be something that your child can get from you. Your fetus can essentially chelate some of those metals from you. And they're very common, and they can take time to detox. And it's usually not as simple as, picking up a supplement at the health food store that's going to take it out. So really being shepherded through that can be a really important process for people.
Mm-hmm. Well, I mentioned to you that I went to a conference a couple of years ago and I interviewed Dr. Joseph Pizzorno. So I'll link that episode to this episode. I just remember one of the things, because that's the world that he's in, and he has teams of people researching for him. And so I remember when he was doing his presentation, he was pulling up, hundreds of studies that were talking about toxicity. And if I remember correctly, his advice for any woman who was thinking about getting pregnant was literally to take a year to do a detoxification protocol prior to pregnancy. And it can be really worrying and concerning, because on the one hand, as women, we need to have this information because we want to put ourselves in the best possible position when we're ready to conceive. But on the other hand, when I got pregnant with my first son, I didn't detoxify my body from heavy metals for a year previous. And a lot of us don't necessarily come to this knowledge before. There's something about motherhood that kind of shepherds us into a lot of this knowledge. So then you're already pregnant, and then you start learning about all this stuff, and you start to feel like, oh my goodness, my baby's going to be full of mercury, and et cetera, et cetera. So how, it's an impossible question, but I'm always thinking about the listeners. And because I'm also, I've been there as well. And so, how do you have this conversation? How do we balance that desire to do everything perfect and have this perfectly clean, wholesome body prior to pregnancy with the woman who is listening, who is already 3 months pregnant and did not do any of these things?
Sure. Yeah, that's often more the case. It's really rare that somebody comes in and says, I want to get pregnant in a year or 2 years. Can we start working on things now? I think that has happened once. Most of the time people come in and it's like, I want to get pregnant next month, or I'm already pregnant. What do I do? So, I would say there is, again, as we discussed earlier, there is going to be no perfectly clean scenario that's going to happen for people. And there's so much that goes into a healthy baby. And some of it is being relaxed and having peace of mind that everything is going to turn out as it's going to turn out. And babies are robust and bodies are robust. So you just start from where you're at. So that might be starting, I would say if you're already pregnant, I would say go ahead and be a little bit more aggressive in getting the chemical cleaners and the chemical products out of your home. Just go ahead and do that. You don't need to be using any substance to detox to do that. And make sure that you're getting a healthy diet that's full of whole foods and full of foods that naturally will support detoxification without pushing your body into sort of an extra detox state, because you don't want to do that when you're pregnant. That's correct, And by doing those things, by eating good foods and taking the chemicals out of your environment, you are going to, for instance, create cleaner breast milk for that baby when it's born. And some of the toxins that we're talking about are not persistent toxins. Some of them do get detoxed out of your body pretty quickly. So if you can cut out that day-to-day exposure, then it's going to be really helpful for that. And there have also been some interesting studies done, for instance, on children with lead exposure, that the healthier the diet, the less the impact on that child. So it didn't have as big of an impact, say, on their nervous system if they were eating well. So just doing those simple things can go a really long way.
Mm-hmm. Well, I feel like what you're speaking to is also the resiliency
yes.
of the human body, because I talk about the birth control pill a lot, and I tend to bash it from time to time, as you know. Sometimes I get responses from women who are saying things like, I can't even believe that women do get pregnant. They come off the pill after using it for 10 years and they get pregnant right away. Ultimately, the body doesn't get pregnant unless it's ready to, for the most part. So I think there has to be a balance in the conversation as well. It's not all doom and gloom. We have to be aware of these things, but our bodies are incredibly resilient. And so I think it's just having these conversations and trying to balance it out. It's not about trying to do a big scare tactic. It's really trying to get out the information that we need to have in order to make the best decisions that we can about our health. One of the things that I appreciated, so in the last point, we were talking about what to do if it's more particular to you, or if a person has a specific challenge, and really working with a practitioner to address it. It seems to me that, especially in the conversation of detoxification, it's like we want to skip the work. We want to skip the part where we have to actually change our habits and actually change our products. And like, we want to skip the part where we have to look at our daily stuff that we're doing every day that is contributing to our toxicity, and go straight to the immediate fix of taking this supplement, or, drinking this tea or whatever. But, because that's largely how our medical system works. I feel like we're in the habit of thinking that way. We're in the habit of thinking that if I have an issue, there should be like a supplement that I can just take to fix it. I don't know if you want to speak to that, but I just wanted to point that out.
Yes, absolutely. I think that is often the case. And even when a person comes to see a naturopath, that can be the case. They just want the pill that's going to be the substitute for the pharmaceutical, because we're in that mindset of, you take that pill, you take that thing, and the symptom goes away, and it seems easier than changing our lifestyle. And I think there's also this idea of, I think we've fallen so out of, as a society, doing self-care that supports our body and its natural, healthy physiology. We've just, over so many hundreds of years, developed pretty bad unnatural habits. And so people look around and they say, like, why do I have to eat this way? Nobody else seems to have to. Why do I have to not wear perfume? Why do I have to do this or that? Why do I have to exercise all the time? Nobody else seems to have to do this or have to go to bed on time. So we have these sort of cultural myths that other people are doing these things and it's not impacting their body. And I think that that's a big part of it. So sometimes when you're asking people to develop these habits, even if they're simple, like drinking enough water and moving your body and deep breathing, in the beginning, they can seem like big burdens, like, oh, I have to do so much self-care, but it's really just doing things that your body naturally wants to and needs to do. So I think kind of changing that mindset and realizing that as a society, we really need to make changes in how we value self-care and how much time we spend doing it. And that's a very important aspect of that. And then also there is, again, this important aspect of understanding that changing your body and correcting its physiology is not just about taking a pill, and you're going to benefit so much more from doing that deeper work. I like to tell people that they're going to get side benefits from doing naturopathic care. So when we detox the body, when you clean it up, when you restore good physiology, you're going to take not just get rid of that symptom, but you're going to get a lot of other things that are going to change for the better in your body, whether that's increased energy, glowing skin, changes in your menstrual cycle, all these kinds of things that are benefits in addition to taking care of that symptom that you came in for. And you're never going to get that from taking a pill, whether that's, just a vitamin or whether that's a pharmaceutical.
Mm-hmm. I love that. Yeah, I love that. I mean, the example that came to mind is, often women are struggling with, low progesterone issues, or they have short luteal phases or spotting post-menstrually. And so, one of the free things that you can do to see if it can help is to sleep in the dark.
Right. Exactly.
Right? And so It's not a supplement. It's like literally like sleeping in the dark. So if I have that conversation with someone and saying something like, okay, well, do you have a street light pouring in your room or something like that? The side benefit of, I don't know, not having all that light pollution and not disrupting your melatonin at night would be that you actually sleep better and wake up feeling more refreshed. So you came in for like this particular issue and you end up coming out with a bunch of other side benefits that you weren't exactly asking for, but are welcome.
Yes, absolutely. Absolutely. So I like things that have the most bang for their buck. And you're exactly right. That sort of thing, like sleeping in total darkness.
It's free, people. It is free and very
absolutely.
effective.
Absolutely.
That one was on the house. All right. Well, so one of the other aspects of it, so kind of to bring it full circle with regards to detoxification. So now we've addressed everything. Our environment is better. Our habits are better. We have a practitioner who's helping us work on our specific issues. And so we have like a treatment plan. And you mentioned, doing annual kind of spring cleaning. So tell us a little bit about what that's about.
Mm-hmm. So I think that this can be an important way to reset and check in on where we are with our habits, because it's easy to maybe, initially do some type of elimination diet or detox diet with your practitioner, and then you slowly get back into your habits where it might feel like, oh, I'm just occasionally having a glass of wine, but the truth is I'm having a glass of wine, 5 nights a week, or I'm just occasionally having a packaged treat, but it turns out I'm having that every single day, right? Or it turns out like I've become a little bit more sloppy with my sleep habits, or I'm not making time to exercise as often, things like that. And so I think it's a good idea to set some times during the year that you're going to do a reset and really prioritize these health habits too. And I think spring and fall are great times to do that. These natural seasonal changes are traditional times to do quote unquote cleanses. And so I think that's a good time to pick a simple reset diet. So for instance, the Whole30 is a great one to follow that helps you get those processed foods out again, and just remember what it feels like to be on a very clean, low processed foods diet. And during that time, I might encourage people to increase certain foods in that. So that might be doing things like shooting for 3 cups of brassica vegetables a day, which helps support your liver detoxification, or adding in things like maybe swapping their coffee for some green tea or some matcha for the extra antioxidant benefits, again, to help with that glutathione production. Maybe doing some Dandy Blend, which is a dandelion burdock drink that is a very simple way to support that detoxification for people, and something that you probably don't need to check in with a practitioner at. Should be easy to do. And then making sure that during that time, you're setting a schedule where you are going to get a good 8 hours of sleep a night. Making sure that you're getting enough movement for your body. Maybe schedule some hikes so you can be out in clean air during that time to nourish your lungs, instead of schedule those with friends instead of maybe going out to eat as a social occasion, something like that. So those can be really good things to do. And then people might consider doing things like visiting an infrared sauna a few times during that week or two that they're working on cleansing, because that can be a great way to just increase that detoxification for people. You might decide to do something like spend some time journaling every day to help that sort of mental, emotional component of the detox, or putting a limit on screen time during that time. So maybe thinking of cleansing during that week or two, twice a year, as full body, full emotional cleanse as well. So those are some things that I like to have people consider doing during that time.
Well, and I love that you bring in the emotional detox aspect of it. Mm-hmm. It's become harder for me now that social media is attached to my business, because I remember fondly a time when I deleted the Facebook app from my phone for a month, and I just didn't go on Facebook for a whole month. And life carried on. You know what I mean? Like, nobody missed me. No one was like, no one was texting me. Like, where are you? Like, everything was fine.
Yeah.
So I like that it's a little harder now for me to do that. But, I like that you brought that in, because it's really like, this helps us. I feel like this has been a very well-rounded conversation. It really helps to take detoxification out of the stereotypical, go to the, convenience store, go to the health food store, purchase like a kit, take a bunch of stuff for a period of time, and then you're detoxed.
Right.
Whereas that's not how this works. Cultivating these habits and thinking about ways to bring this into our day-to-day lives is a way to kind of create a state of sustained health. Like, this is something that if you started it now and continued these practices and did your annual check-ins and all these things, I mean, your health, 6 months from now, 2 months from now, but your health 5-6 years from now could be in a completely different place just by following everything that we talked about today on the podcast.
Absolutely. Yeah. and I was going to say, and most of those things, after a while, they just become habits. It's like brushing your teeth. So it's no longer following a plan. It's just doing what you do.
Love that. Well, we went through so much today. I feel like this was very productive. I've loved being in this conversation. So thank you so much, Erika. This has been really great. So if there was one thing that you could leave the listeners with, just kind of final thoughts or something from the listener's perspective, what would you want them to take away from our conversation?
Ooh, that's a great question. I think that I want them to remember what I had mentioned earlier about maybe visiting the environmental working group as a great resource for looking at things like just being able to look at what you're putting on your body and what you're using for cleaning. And they even have some great food resources there for looking at packaged foods too. So that, and then I am just going to say again, emphasizing that day-to-day habits are the most important thing.
Love it. Yes. So for the listeners who just happen to be in Colorado where you are, and now they want to storm your office door and have some support with their mysteries and or detoxification protocols, maybe share a little bit about what you do locally, but also if there's other ways to connect with you. Yeah.
Sure. So I am outside of downtown Denver, and people can find me at healingrootsclinic.com. And I've got lots of blogs about detoxification on there and different conditions. So I invite people to check that out, and they can sign up for my newsletter as well to get sort of a monthly update and tips.
Awesome. Well, thank you so much for being here. This has been just a wonderful episode. I know this is going to be one of the episodes that I refer people to on a regular basis already. So thank you so much.
Great.
Thank you for listening. If you enjoyed today's show, please share it with a friend. You'll find the show notes page for today's episode over at fertilityfriday.com/266.
I hope that you enjoyed my interview with Erika, Dr. Erika Enos. Thank you again, Erika, for coming on the show. It was a pleasure to have a second opportunity to talk with you. And you could tell from my enthusiasm, just regarding the subject matter, I really enjoyed having the opportunity to talk about detoxification and to talk about it in a very whole and complete holistic type of way. And you can tell for any of the listeners, if you've listened to the podcast for, any length of time, then you've already just had the opportunity to discover my perspective on detoxification. I find that it's really easy to want to have the simple answers. It's really easy to want to have if you have an issue, just to be told to take these 5 supplements and to have it fix everything, because it really aligns with the way that we've been taught about our bodies and the medical system. So with the medical system, that old adage, a pill for every ill, that's how the traditional medical system works. And that's how a lot of us really think about illness. And even with regards to the menstrual cycle and menstrual cycle challenges, that's often one of the most difficult beliefs to overcome, which is just that all you need to do is find the supplement and that's going to fix everything. When what I've seen over the years in my capacity as a fertility awareness educator and holistic reproductive health practitioner, and also over, years of interviewing health professionals with the podcast, what I've seen is that, the supplementation thing can only get you so far. In order to achieve the type of, optimal health that we're looking for, it really is a combination of the lifestyle factors, our chemical exposures, our day-to-day habits and practices. And that includes everything that Dr. Enos was talking about with us today, from our sleep habits to, our breathing habits to our water consumption and just those day-to-day habits that we're doing, and even getting a hold of our emotional state and trying to clear our mind, making sure that we're cultivating a sense of peace within our own minds. And so that's why you'll see a lot of podcast episodes about meditation and mindfulness and, the energetic aspects about fertility and health, because those play a role as well. And so it would be so much easier just to say, okay, take a supplement and that's it. But, in addition to those lifestyle factors, the day-to-day habits that we have, we also have to look at what we're eating. And I think it can be really jarring and even a little bit intimidating to find out how significantly diet can impact it. It's so much easier just to think, okay, I'm just going to take some vitamin B12 and everything will be fine, or whatever the case is. But when you realize, I love the example that Dr. Enos shared when she shared that she had a client who had terrible acne. And, the first port of call was to really address a lot of these lifestyle factors. And just by doing those things, the acne didn't fully go away. It wasn't magic. But after a period of about 4 weeks, her patient saw a dramatic improvement. And, that's the amazing but also challenging aspect of a natural route or a holistic route. Because when you're working with your body and when you're working to change your daily habits, when you're working to change those lifestyle factors and those dietary changes, first of all, it can take some time to figure out what is actually going to work best for your body. But second of all, when you have figured that out and you are on the right path, it doesn't happen immediately overnight. It's not the same as, having a headache and taking an ibuprofen. When you have a headache and you take a painkiller, depending on the intensity of the headache, typically the headache goes away within a short period of time, or at least you're able to kind of feel an improvement quite quickly after you do it. The difference when you're making, life changes, when you're changing your habits, when you're reducing your toxin exposure, it's not the same. It's not like you're flipping a switch and the next day everything's going to be better. But when you stick with it over a period of time, especially if you track your progress. So menstrual cycle tracking is really, really helpful in this regard because you are able to track. You don't necessarily notice the shifts on a day-to-day basis, but when you look back over the course of, 1, 2, 3, 4, 6 cycles, then you can really start to see the progress that you've made. So that's one of the reasons why I love tracking and having that as a central part of what I do, because it really gives you this way to keep track of what you're doing, because it's much easier to look at 2 months worth of charts than to feel the shift on a day-to-day basis, because sometimes it's quite gradual and you don't really pick up on the subtle changes. You might not notice if you go from having, 15 pimples to having 12, but over a period of 2 to 3 months, you might be able to then see the dramatic difference between having a face full of zits and having, a significant reduction. And so I'm really glad that we were able to have this conversation today and essentially address some of the myths about detoxification. And, if I were to list just off the top of my head what I consider to be some of the myths about detoxification, I would say, the myth is detoxification is this thing that you do either once or once in a while, as opposed to recognizing that your body is naturally detoxifying all the time. And so, to support your body's detoxification systems, it's really more of a long-term thing. It's not something that you're just going to do once in a while. It's something that you could actively support your body in doing every single day by cultivating good habits and by addressing your, additional exposures and all the things that we spoke about in today's episode. And then if I were to think of another myth about detoxification, again, it would be that the primary way to help your body to detoxify would be to, take a whole bunch of supplements and to really go and do a specific cleanse when you're taking a bunch of stuff to kind of force your body or, force your liver to do things differently and all those types of things. And not that there's anything wrong with doing that, but one of the things I appreciated about the conversation today was that aspect of targeted supplementation and really addressing, specific issues that you might be facing or addressing specific toxicities and things like that. That was not number 1 on the list. That was number 3 on the list. And that was in working with a practitioner to support specific things that have been addressed in a professional setting, meaning that there's a ton that you can do on your own before you ever get to that point. And in many ways, before you even start jumping to the supplementation and jumping to the specific detoxes and all that type of stuff, start with, step 1, first remove toxins, second, address your daily habits, and then let that, see what happens first before you jump to the thought that I need to detoxify this and I need to take these supplements and I need to do all of this stuff. When you think about it that way, the specific addressing of protocols, that comes later. That comes after addressing a lot of these lifestyle factors. And so, ultimately, that is what I really appreciated about today's episode. So we will be talking about detoxification in the Fertility Friday Facebook group. So make sure to, join us in there, fertilityfriday.com/community. If you've had an interesting experience with detoxification, whether you have done the gradual detox, if you've been removing chemicals from your house for a while and gradually improving your diet, and you've been tracking your cycles and you've seen some improvements, we want to hear about that. And if you've had a different experience where you actually did go and do like a targeted cleanse for a while and you saw improvements, we also want to hear about that. So we'll chat more about that in our Facebook group.
So I just want to thank you once again for spending some time with me today. I appreciate you for tuning into the show and for supporting the show, sharing the show with your friends. I'll start a thread in the Fertility Friday Facebook group for today's episode so that we can talk about the different ways that you have, reduced your exposure to different, whether it's environmental toxins or household cleaners, beauty products. It's always a big conversation, and it's a conversation that we always keep going within the Fertility Friday community and, of course, in my client work, because, as soon as you start charting your cycles, then you have this very physical measure, this very physical record of what's happening in your cycles. And it can be really eye-opening and really surprising how much your cycle can change. Now, not all women are going to notice a huge change in their cycle when they start reducing their chemical exposure, but many women do. And sometimes it's just, subtle indications that show that you're moving in the right direction. And other times it's very significant. Some women experience a shift in their pain and their PMS symptoms because just by simply removing a lot of these chemicals that mimic estrogen and interfere with our normal hormonal production, it can really just positively impact our cycles. So I want to see what's going on with you, and I want to see and learn more about your suggestions, different products that you've tried, different things that have worked for you. It can be a challenge when you're removing products. I know for me, it took me a while to find dishwashing liquid that actually worked and bathroom cleaner that actually worked because I'm all about going green, but at the end of the day, I still need to scrub that toilet. I still need to get it clean. So let's share our best, tips and products and things like that in the Fertility Friday Facebook group. So if you're not a member, fertilityfriday.com/community. Look forward to seeing you in there. If you haven't yet grabbed your copy of The Fifth Vital Sign, make sure to get your copy in whatever format is your favorite. So whether that is ebook, so like a Kindle or something like that, the paperback version or the audiobook, you can grab your free download of the audiobook by signing up for your free trial with Audible. So fertilityfriday.com/audible. And with that, I hope you have a wonderful weekend or week whenever you are listening to this episode. I look forward to seeing you again next week. And of course, as always, until next time, be well and happy charting.